the challenge with this is if the band is at the level of the hand, well, now you have to go through the wrist joint, the elbow joint, to eventually centrate through the humerus. So your resistance is 2 joints away from the region that you're trying to stabilize. So this can be a higher demand. It can be more difficult for the patient, and there may be a higher likelihood that they may compensate into an anterior glide of the humerus. So how do we change that? How do we create this exercise so the resistance is specifically at the humerus? Well, all you have to do is just place the band closer. In order to do this, you just tie a loop on the edge of the band. So it could be a normal resistive or TheraBand. You take one end of the loop and you thread it through just like so. So now you have one end of the loop threaded through. And this makes a nice little hole that you can slide the humerus or the arm bone through. You're then going to take this and rotate it, put it through the patient's arm, and slide it down so it's close to the joint. So this is called a hitch, or also known as a girth hitch. You're going to then take the band and you're going to rotate it around the humerus, applying as much tension as you need, and then you'll rotate it around a second time, pulling the humerus into external rotation, so the patient then has to go into internal rotation. Patient will bring their arm down, and then now you can align the band, making sure the patient maintains that posterior directed humerus, and have the patient now go into internal rotation with a resistance that's more proximal on the humerus. Go through that one more time. One final time. Now you can see that this provides a much more centrated force for the patient. So how do we progress this? Once we take this band and we wrap it around the proximal aspect of the humerus, and we want to make it more of a challenge, well, we could take the other end of the band, tie a loop, and place it right in their hand, or even at the level of the wrist. We'll take the band, pull it out directly, and then have the patient go through the same internal rotation with one level of the band at the humerus and the second level of the band at the hand, mirroring that position going to acceleration from a late cocking phase. You can even take the patient further into late cocking, apply your resistance, take them all the way back into more humeral rotation, and play around with the different positions so it mirrors your throw. But conceptually, I want you to remember you have options when you choose your humeral resistance. You can have it at the level of the humerus, or you can have it more distally.